We are back with Heart Health Today. About 48% of adults in this country have high blood pressure or hypertension. If left untreated, it can lead to a number of serious health concerns. Here with 5 ways to keep your blood pressure in check. Back again, NBC News medical contributor Dr. Natalie Azar. Natalie, good morning again.
Hi,
so why should we care first and foremost about high blood pressure?
Well, you know, Willie, we often talk about high blood pressure as the silent killer, which I know sounds a little bit strong, but a lot of people, a majority of people actually don't know that they have high blood pressure. Very often it's asymptomatic. But look at the complications that it can lead to: stroke, coronary artery disease, heart failure, aneurysms, kidney disease. So knowing your blood pressure number and keeping it in check is so important.
All right, and you've got, luckily, some tips on how we can monitor and take care of that.
So first of all, what's normal? Normal is 120/80 or below. As you start moving those numbers up, the systolic and diastolic, we get into stage 1, stage 2, and on up. Measuring blood pressure at home is definitely something you can do. You're going to get a blood pressure monitor. It's going to go across the arm over here. You want to be sitting at a table, feet flat on the floor, back resting against a chair, and you want to have the arm at heart level. This is incredibly important. You want to measure it around the same time every day. No smoking, alcohol, or exercise 30 minutes before. You want to get 2 readings at least 1 minute apart. And I always tell people, if you can, maybe you want to try to correlate it with what you're getting at the doctor's office to know that your blood pressure monitor is accurate. But again, and if you do it in the morning, you want to do it before you take your blood pressure medications.
Okay, that number's good too, because I never quite remember what's good and what's bad.
Exactly.
120/80 is the target.
That's your target.
Okay,
Yep.
let's talk about salt.
Okay, so what is the big culprit in terms of high blood pressure? Well, it's table salt, which is sodium chloride. How can you reduce the amount of sodium chloride you take in? Well, you can use a salt substitute. What they do is they substitute, instead of sodium, they put in some potassium. This is good for most people unless you have certain medical conditions like chronic kidney disease or are on certain medications. So talk to your doc before you start using it. And then, with salt gives everything so much flavor, use other things. Garlic, black pepper, spices, vinegar. Really, like I almost said medicine cabinet, your
pantry.
Your pantry. Yeah. Your pantry is your oyster in this way, because you can really spice up food without always referring to salt.
I'm very guilty of over-salting.
Me too.
Diet and nutrition, what are we looking at here?
So in addition to salt, and by the way, I failed to mention, a teaspoon of salt is actually too much. I just realized yesterday that I probably have 10 teaspoons of salt a day, which I know might be an exaggeration, but we all really need to keep that in mind. A teaspoon, it's already a little bit too much.
Okay.
So what the health experts really advocate for is something called the DASH diet. That stands for Dietary Approaches to Stop Hypertension. In addition to lowering salt, we're talking about eating a lot of vegetables, fruits, whole grains, low-fat dairy, fish, poultry, beans, and nuts. These all contain a lot of potassium, magnesium, calcium, protein, and fiber, which really helps to lower blood pressure.
And with everything, we want to maintain a healthy lifestyle as well.
And I know people have heard this, and nothing is new here, but it always merits reinforcement. Regular physical activity, managing your stress, avoiding smoking, and keeping a healthy weight all will help to keep your blood pressure in check and keep healthy.
Good advice for whatever ails you.
Exactly.
That's a good checklist right there. All right, Dr. Azar, thanks so much.
Welcome.
We appreciate it.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC, or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.